Now starting. All attendees are in listen-only mode.
Good afternoon and good morning, and welcome to the Population Health Research Network's Webinar Wednesdays, kindly hosted by the ARDC. This is our fifth Wednesday lunchtime webinar for 2020, showcasing researchers who have used the PHRN network to assist with data linkage in their specific research. And this week, I would like to introduce to you Dr. Melissa O'Donnell, who's a Senior Research Fellow from the Telethon Kids Institute, to talk to you on using linked data to provide evidence for improved policy and support for vulnerable children and families. Now, we will take questions at the end of her presentation, and you can type your question in the box on the right-hand side of your screen. But now we'll hand over to you, Melissa. Thank you and welcome.
Great. Thank you. And thank you for the opportunity to present my research. It's a really good opportunity to talk about the issues now, particularly at the moment when we've got so many vulnerable families in the community with the COVID. And I'd first like to acknowledge the Whadjuk people of the Noongar Nation as the traditional custodians of the land that I'm meeting on. And for those on other lands around the country, I wish to acknowledge the traditional custodians of our lands and pay my respect to elders past, present and emerging, and thank them for their wisdom and knowledge. I'll first just give an outline of my presentation. So I'll be talking about the Developmental Pathways project where I received my data from, the cross-agency data linkage, and talk about specifically how I've used it in the area of child abuse and neglect in vulnerable families. I'll talk about my previous and current research and the policy translation we've tried to achieve with it, and the future directions and challenges of using linked data. So the Developmental Pathways project commenced as an ARC linkage project in 2005, and we had a second in 2010, and we've just recently applied for our third, so we're just waiting on the outcomes of that. So it was originally led by Professor Fiona Stanley, and we've got a new CIA, who's Professor David Preen from University of Western Australia. And we've got partner agencies across Treasury, Health, Education, Mental Health, etc. So we've got a broad range of industry partners, which is really important for the research that we're doing. The developmental pathways really aim to improve the understanding of child, family and community factors involved in pathways to a number of outcomes, such as juvenile offending and my area of child abuse and neglect, as well as a range of other areas. And really, we were really trying to identify where in those pathways we needed to optimally intervene, as well as try to monitor outcomes and evaluation of initiatives and policies. So really that was the overall aim of the project. In WA, we've Fiona Stanley luckily had really looked at data linkage as a way forward in terms of research. So from the 1980s, Western Australia has been linking data, which was predominantly the health data sets across birth registrations, midwives, notifications, deaths. They linked the hospital morbidity data as well as the mental health register data. And obviously we had the electoral roll data and more recently the emergency department data from the 90s. So as you can see, there was linkage going on from the 70s cohorts onwards. And what the Developmental Pathways project really tried to achieve is the linkage of data from those other really important areas such as education and NAPLAN data and attendance and suspensions data, the justice and police data, as well as child protection data, disability data and housing data. And in WA, they really worked to establish a family connections database, which included their parents and children and siblings. So that enabled the researchers to really get a better understanding of the data in terms of family cohorts as well. I guess that, many of you will understand that, using data such as this creates a lot of opportunities because it's total population. It captures those vulnerable children and families who are really hard to get involved in surveys. It's existing data, so it's already been collected by the agencies, which has pros and cons because sometimes it's not really fit for purpose. However, it is cheap and we can monitor some of the important indicators over time, as well as look at the impact and evaluation of strategies and initiatives on those indicators. The other thing for me, I guess, is we can analyse very sensitive information that that most families wouldn't want to talk to researchers about, particularly child abuse and neglect, and their own mental health issues and substance use. And that's why I find having the de-identified data to protect people's privacy is really key. And I think the other advantage of using the linked data for me is that by using government's own data, it seems to be sometimes more convincing for agencies and treasuries. We don't have to convince them of the data that's been collected. So I think that does give us an added advantage. Now, I want to talk about how we've utilised the linked data in terms of child abuse and neglect, and how we've used it to really work with and identify issues and priorities for vulnerable families. Just to give you an understanding of child protector burden in Australia, across Australia we have seen an increase in the number of children receiving child protection services. So that includes investigations of notifications of child maltreatment, as well as children who enter out-of-home care. In 2018 and 19, during that period, over 170,000 children in Australia received child protection services. So we're looking at about 1 in 33 children. National figures indicate that the numbers of children being notified to child protection services has increased and continued to increase over time. So we're looking at about 48 per 1,000 children who are being notified to child protection agencies in Australia. However, the substantiation rate and the rate of children in out-of-home care is more stable, which is possibly an indication of the capacity of the system to respond, and as well as a changing threshold for intervention. And we have around 45,000 children in out-of-home care across Australia. As you can see, the rates mask, the national rates mask the huge disparity in child protection involvement for Aboriginal and non-Aboriginal children. So Aboriginal children have high and increasing rates of children in out-of-home care, which you can see is the purple line above, with about 54 per 1,000 in out-of-home care. So that's 10 times the rate of non-Aboriginal children. And some of our most recent Aboriginal social justice reports have said that Aboriginal children in out-of-home care is one of our most pressing social justice issues in Australia. The challenge with child abuse and neglect and child protection involvement is that it's a multi-agency problem, and it impacts on many agencies such as health, social services, police, education, etc. So really, the response, you know, we're seeing that the response from health and welfare agencies has been often to focus on the end of the pathways when these problems are harder to manage or treat and successful resolution is harder to achieve. The complexity is that we really need to see an investment in preventive and early intervention approaches to working with vulnerable families and the provision of effective services for those who are affected. And we know this from a lot of research, that solutions are more likely to come from those agencies working together. However, agencies responsible for intervening earlier are often different from the role and expertise of the agencies responsible for the end stage outcome. So really we're hoping that the cross-agency data will promote cross-agency strategies to address these complex issues. So it was a while ago now, it was about 2008, we produced this paper on child abuse and neglect and the need for a public health approach. And in it, we argued that universal initiatives were really important to support for all families, with more specific targeted strategies for those more vulnerable families who have identified needs. However, we also argued that there's a need for data and evidence to monitor trends and the impact of our strategies, as well as identify those groups who are most at risk for prevention and intervention. And we submitted this to COAG for the consultation for a national child protection framework. And in that, the COAG decided that they would want to implement a public health approach, and in it they referenced our paper. So really, we tried to say that the statutory system for families needs to be really the tip of the intervention, and it shouldn't really, our focus needs to be on universal prevention initiatives and early intervention services. So, however, convincing, I guess, Treasury and the departments about that there's the need for both areas of resourcing is really still a challenge, I think, for Australia and other countries throughout the world, not just ours. But really, we've tried to use the data to provide evidence for those areas. One of the first areas we really tried to work on was use our research to improve child maltreatment surveillance and monitoring. So as you can see, there's a number of data sets that are available that can be used for monitoring child maltreatment, such as hospital morbidity data, emergency department data, child protection agency data, and mortality data. And we really felt it was important to give feedback to data custodians regarding the data that we were utilising for research, as well as improve the data. And we really tried to focus on emergency department presentations, which I know across Australia is an issue for any public health issue, whether it be suicide and self-harm or child maltreatment and assault and family and domestic violence. And this is an issue I'm still working on now. However, we were able to use the linkage of the data to really get an understanding of how we could give information back to health about how their surveillance approaches were going. So we linked the child protection and hospital admissions data and identified those hospital admissions for child maltreatment. So what we did find was that children with a maltreatment-related hospital admission, 90% did have child protection involvement. And with that, 81% had allegations, as well as 68% having substantiated allegations and 50% entering care. So from that, we realised that within the first 4 days after a child maltreatment hospital admission, an allegation was made to the Department for Child Protection. And half of those were actually the first notification to the department. So the hospital was identifying new cases of child maltreatment. And there was a high level of substantiation. So 82% of those were actually substantiated. So it really did show that hospitals were notifying legitimate cases of child maltreatment and that they were being substantiated by the department as well. This has led us on to more international comparisons of indicators of child maltreatment. So working with Ruth Gilbert in London, we worked with the United Kingdom, USA, Sweden, New Zealand, Canada and Australia to look at child maltreatment indicators across our countries. We found that in many countries there was a reduction in child maltreatment deaths. There was an increase in maltreatment-related injuries and there was an increase in child protection involvement. But across all those indicators and across the countries, we didn't find consistent evidence of a decrease in those indicators of child maltreatment, apart from the child maltreatment deaths. And this is despite many policy initiatives that have been aimed at reducing child maltreatment. From that, the international efforts, I was invited to attend a United Nations meeting to look at how we can use big data for monitoring the United Nations Sustainable Development Goals. And one of those goals is the reduction of violence for women and children. And so really we're trying to talk about how we can monitor those issues internationally, as well as put a focus for our own countries on those indicators that are important for us to reduce and to work on strategies to reduce the violence against children and families. We also have, I'm involved in the International Working Group on Child Maltreatment Data Collections, and we had our recent meeting in 2018. We were supposed to have one in Adelaide this year, but it's been delayed till next year. But really we're trying to bring together international researchers who really want to look at child maltreatment monitoring and evaluation across our countries and to improve that. I think this is an issue particularly important in the time of COVID, because while we're doing a really good job at monitoring the impact on health in terms of COVID cases throughout the country and monitoring those and the impact on the health system, I think we still have a lot of work to do in terms of the social impact. We know that in times of crisis such as these, child maltreatment and family and domestic violence increases. And so we're trying to find evidence, and I urge all the researchers on this meeting to really look at how we can support government in these initiatives. So the most recent data we've been able to get is from our Department of Communities in terms of child protection central intake calls for notifications of children who are vulnerable and in need and potentially need to be assessed for maltreatment. So we have seen a rise. So February 20 and 2020 and March 2020, we've definitely seen a rise in the Child Protection Central intake calls. And we're just waiting on the next data for April and May to look at whether that trend is increasing. And we've also seen that in terms of the Women's Domestic Violence Helpline calls as well. So we've seen a rise in the last, across since basically November and December. And then obviously it's rising through this COVID crisis period. So I think these are definitely indicators that we need to keep an eye on, and in terms of the impact on those families. And we do know that there's been a rise in the need for refuges, for families who are seeking support and protection. And so the government is working quite hard on enabling that to occur as quickly as possible. In terms of the other way we can utilise linked data is to investigate the risk and protective factors for families. So there's a broad range of factors that impact on families, and they're at the child level, the parental level and the community level. And with the linked data, we can really determine the trends in those factors and identify areas of concern, and particularly where to intervene with prevention and early intervention, and really to promote those cross-agency responses to deal with the complex challenges. I'll give you an example of how we've done that. A while ago, we did a paper on to investigate. We'd heard anecdotally that our primary maternity hospital was that women were using substances more during pregnancy, and that this was becoming an increasing issue for maternity hospitals to deal with. But we didn't really have as much hard evidence of that. So what we decided to investigate was the rate of babies being born with neonatal withdrawal syndrome. And we did show an increasing rate of diagnosis. However, during that time, there was an increase in drug use among women, and that was obviously being played out in the rates of maternal substance use during pregnancy and the effect on their babies. However, we did see a stabilisation from 2001 onwards. However, we also determined that those babies were more likely to spend time in intensive care and longer amounts of time in intensive care, and they were 8 times more likely to have a substantiated child maltreatment allegation and 10 times more likely to be removed from their families within the first 3 years of life. We got a lot of media attention, and I'm not sure if this was a good thing or a bad thing, and I'm still not sure, but we didn't want women to be stigmatised. Really, we wanted to get support for these families, but we did see big headlines in the national media on this. However, we didn't get invited to present our research to maternity hospitals and child protection departments. And we were also invited to the impact of parental drug and alcohol use on pregnancy and newborns working party, and they're responsible for policy and practice in this area. And so they were reviewing the pre-birth interagency protocols between the Departments of Health and Child Protection. Importantly, we were told that the Women and Newborn Drug and Alcohol Service in WA did receive some extra funding to deal with the rise in these complex cases. And obviously, we were really trying to advocate for an increase in long-term support offered to mothers with substance use issues. And it also resulted in a lot of international interest in this issue. So I was involved in an international comparison between England, USA, Australia and Canada, where we showed that in England and WA, we did see a stabilisation of rates. However, in the USA and Canada, we saw increasing rates, which I believe is still a huge issue in terms of the increasing rates of substance use during pregnancy and the impact on babies being born. So it's definitely an area that needs more work in terms of intervention and support. We also know that with substance use often comes mental health issues, and we did try to quantify the risk in our linked data of maternal mental health issues and child protection involvement. So we linked the mental health data with the child protection data, and we found that for non-Aboriginal mothers, having a mental health contact increased the risk of child maltreatment allegations by 3 times, and for non-Aboriginal and for Aboriginal mothers, this increased. There was a double of the increase. But in terms of perinatal mental health contacts, that's where we found there was a really important area in terms of increased risk. So they did have a higher risk of child maltreatment allegations. And this is an area that we feel that there needed to be more work done. And obviously, perinatal mental health issues is becoming an increasing area for intervention and support, as well as ongoing after birth with postnatal depression. So we do know that this is a group that require that extra support. And we also showed that there was increased risk in particular groups. So all mental health issues increased risk. There's specific disorders that did increase risk, such as personality disorder and substance use disorders. And we also know that intellectual disability is probably one of the highest increasing risks. And to try to get an understanding of the issue of maternal mental health and substance use, what we were able to do was to really, we were able to look at those that only had a mental health disorder that wasn't substance related, and we showed that there was an increased risk. We're able to show that for substance related disorders, yes, there was an increased risk almost 3 times. But if you had both of those disorders, so you had a comorbidity of a mental health disorder and a substance related disorder, it increased your risk 5 times for involvement in child protection and having an allegation. So this is a group that requires specific intervention, and that's actually quite difficult because often mental health services focus on mental health issues, substance use services focus on substance use issues, but that comorbidity is really important to address, and we need more services that have those specialised skills to deal with the comorbidity. And we also know in terms of the trifecta of factors that increase child maltreatment in families is family domestic violence issues. So in Western Australia, we've been able to work with the police to get access to family and domestic violence data from the police department, and they were able to link that to our other data sets. So my PhD student, Carol Law, has really been working in this area in terms of producing papers on that data set, which is the first time it's been linked in Western Australia, and I don't think many other states have that data, but I'd be keen to hear from others who are utilising it. So really we were able to utilise that linked data to show that for the children in families where a mother was identified as having family domestic violence, there was an increased risk of developmental vulnerability compared to those that didn't have any exposure. And this increased across all the domains on the AEDC, but particularly so for behavioural problems and emotional problems, which showed higher risk. And we're doing a lot more work in this area because we think it's really needed in terms of the impact on children of family and domestic violence. We were also able to really look at children with disabilities who we always knew had an increased risk of child maltreatment. However, we were never really able to quantify that in an Australian sample. So using our linked data, we were able to show that, that children with disabilities did have an increased risk. So in the general population, as you can see from the slide, about 5% of children in general have a child maltreatment allegation. However, for children with disabilities, this was almost double. So over 11% of those children had a child maltreatment allegation. They also had 3 times more likely to have a substantiated allegation and to enter out-of-home care. And we know this is why the out-of-home care system has so much complexity, because those children also have very complex health needs and other needs. So they're even a more vulnerable group in terms of providing services and ensuring that they have the supports they need. We were also able to really understand that not all disability groups are the same. By clumping children in one category of having a disability or not, didn't really give us a lot of information about those groups that need extra targeting and support. So we basically broke the disabilities down into different subgroups, and there was a lot of variation across those groups. So intellectual disability, they were over 4 times more likely to have contact with child protection and involvement. They were also more likely to enter out-of-home care. And the other groups that had increased risk were children with more general mental and behavioural disorders, and particularly conduct disorder, which had over almost 6 times increased risk. So those are the groups that we're really quite concerned about in terms of the support that's being provided. The other groups where we didn't show as much increased risk was Down syndrome, birth defects and autism, which for me was quite surprising. I didn't expect there to be such variation across those groups. But it really shows that in those families with intellectual disability and conduct disorder where the children have those issues, there is also a combination of other issues such as maternal mental health issues and other problems. So it's often the co-occurrence of those issues, but even with adjustment, those groups are still have high needs and really should be a focus for intervention and support. I guess in terms of all of that research that we've done, we've really tried to assist the government in terms of early intervention and family support needs, to integrate the groups who require that extra family support and early intervention. And the government, West Australian government, did produce a report, a strategy in 2016 on earlier intervention and family support, which is really focused on addressing those groups. However, there are some emerging issues which we've been able to capture within the data. So my work has now progressed to investigate the increases in mothers being reported prenatally and their children removed quite early within the first 30 days after birth. And we have a lot of children being removed from maternity hospitals around Australia now. So this is an area we feel that we do need more evidence and research. So we know that infants have the highest rate of admission into out-of-home care, and you can see that by the chart. But as you can see, there is a huge disparity, again, with Aboriginal infants. So this graph shows that Aboriginal infants have 10 times the rate of removals of non-Aboriginal children. And the other issue is that they are taking up, you know, I just looked at the data yesterday, and 50% of children being removed within the first year are Aboriginal children. So this is an area where we need a lot of work to reduce those numbers. So really, we're trying to utilise the linked data of infants in care, and we've sort of found that there are definitely risk factors. So in terms of substance use during pregnancy, which was identified from the neonatal withdrawal syndrome work, this is an area where there's great need. But we also found there were greater proportions of removal from remote and disadvantaged communities. And I think this is where we need to do more research to really identify what those factors are as well. We did produce a paper on infant removals and the need to address the overrepresentation of Aboriginal infants and the community concerns of another stolen generation. And this paper really came out of Noongar elders coming to speak to Fiona Stanley about their concerns about the high numbers of removals occurring in their community. So we've really tried to raise this issue and produce the evidence that this is indeed the fact and that this is a priority requiring urgent action. We've also started, we commenced a study with Stephanie Taplin at Australian Catholic University, as well as Rhonda Marriott at Nankyera. And we're really trying to look at the impact, the nature, extent and impact of the removal in infants for newborns. And this research is being conducted using the ARHW National Child Protection Dataset, which we've actually been able to get now. We're receiving this year the unit record data, so we can really look more closely at that data set, which has been collected across Australia. We're also utilising linked Western Australian data and linked New South Wales data, as well as working with Karen Broadhurst in England at Lancaster University and Fred Wilson from USA in Chicago. And it's a mixed method studies using the linked data, case file reviews, as well as interviews with mothers and service providers. And I guess our aim is to really look at how pre-birth guidelines are being used to work with vulnerable mothers and families and really improve the safety and optimise the health outcomes of their infants. We're also looking at, with an international group, we've now established an international network on infants, toddlers and child protection, which is led by Harriet Ward from Oxford University, to look at how we can develop more international ethical removal processes, as well as practices in relation to prenatal reporting responses. and look at where we can identify appropriate early intervention strategies that may reduce the need for babies to be removed from their families, and how we can work with them to improve safety and outcomes. The other area which linked data is really important for is exploring the outcomes of young people who've experienced out-of-home care. So we've used a matched case control study to really compare children who've been in care with those maltreated but not entered care, and with a control group of those who've had child protection contact and matched on Aboriginality, socioeconomic status and birth year, and we followed them to 23 years of age. And I'll just briefly talk about the range of indicators we've been able to look at in terms of those outcomes, such as hospitalisations, and we've identified that pregnancy and birth hospitalisations are really high in this group. Injuries and poisoning are a lot higher, and obviously mental and behavioural disorders. But we also found the mortality rate was higher, 3 times higher than the matched control group, with suicide being the main cause of death. Juvenile justice outcomes were inordinately high for young people in care, so over 35%. But what we did find was that there was a reduction in adult justice outcomes for this group. However, there was still that huge discrepancy with the care group having a lot higher involvement in adult justice services. And obviously educational outcomes was a huge issue, with only 18% of children in care having a high school completion, which obviously impacts their ability and likelihood to go to university, although it wasn't as bad in terms of vocational training outcomes. And the children in care cohort, this was a group that we're really concerned about. So for that group that did have a pregnancy who were in care, we worked with the Child Protection Department here in Western Australia to identify whether those children then had ended up with child protection involvement. And we were able to determine that those females who had been in care and who had a child, 72% of those children then went on to be notified, and 24% of them ended up in care. So basically 1 in 4 of those children that were born from children in care ended up back in care. So this is really the intergenerational cycle of child abuse and neglect, and an area that needs work. So we've advocated for the Home Stretch campaign to increase care for care leavers till 21 years of age. And following the Auditor General's inquiry that was done in Western Australia and the research report that we submitted, the Minister announced a trial to increase care till 21. So we're involved in the co-design of a home stretch pilot, and we've had the first intake last year, and the evaluation's happening across 2019 and 20. And we're hoping that with the evidence that we can generate and really look at how we can improve the trial, as well as the outcomes for those care leavers, will be able to roll it out in 2021. We're already hearing that during COVID, young people are being kept in care longer because there is nowhere else for them to go when they turn 18. There are challenges and opportunities in terms of data, and I'll just end on this slide. We're really utilising geographical mapping now to have more pace-based strategies to deal with these issues. And the work of Rebecca Glowett and Scott Sims at the Telethon Kids Institute has been to develop a child development atlas that they'll be launching this year to really enable that access to data. The other challenge, though, is that agencies aren't collecting the right data in terms of interventions and programs that people are being exposed to, and the dose that they receive. And this is a real challenge in terms of looking at the impact of interventions. Also, the timeliness of data, particularly in the time of COVID, when we're trying to do rapid responses to emerging issues and rising issues, it's hard when your data's a year old. So that is definitely going to be a challenge for most researchers. Working with the agency is a challenge and an opportunity. To work with such sensitive issues such as infant removals does cause a lot of sensitivities. But I think by working together, we can really improve the outcomes of families and have the evidence that's required. And we'll always have the dilemma of money for acute services versus prevention and early intervention initiatives. And I think this is where we really need data to inform those strategies and to prove their effectiveness. And I'd just like to acknowledge all the people of Western Australia in which I use their de-identified data, and my co-authors and collaborators and our agency partners. So thank you.
Thank you, Melissa, for a very informative presentation and very relevant also for this time in COVID. We will open up now for questions. Like before, I said you can type your questions in the right-hand question box, and I can read those questions to Melissa. We've currently got one question at the moment, and it says, this was a fantastic presentation. What I would be interested to know is your experience in information governance around collecting and managing such disparate data set. What hurdles did you face or are facing? Thank you.
Okay, yeah, it has been a challenge. We initially, when we were trying to link data, we actually had to get legislative change to get the Department of Justice data. So that took 3 years in itself. So it is definitely, it definitely has been a challenge. I think the promising thing is that I think state and national governments are very aware of this. And so they're trying to address it. So we're having much more, I guess, greater governance that's being arranged in terms of privacy and data legislation, which will enable the data to be used by researchers around Australia. And also, I think, there are agencies working harder to get researcher access, such as the ARHW. 5 years ago, I couldn't get any data, unit record data from the ARHW National Child Protection Minimum data set. But in the last year, we've really been working together to get access. And it is lengthy. It does take time in terms of getting all those state approvals. But I think we're seeing improvements in that. We work quite closely with our government agencies. So we have a Director General Steering Committee. We also have a research management group made up of all the government agencies. And that's really important to bring them on the journey with you. And I think that's really key. I think that's been key. I think that's how Fiona got it and running as quickly as she did, even though it still took us 3 to 5 years to really get the whole system working. And even now we're seeing delays in terms of government, how government are responding. And at the moment during COVID, the delivery of data to researchers has been a reduced priority. I think that will be a challenge at the moment for researchers around Australia. But I really encourage you to work with your government agencies to talk about the importance of this research and for monitoring those social impacts.
Thank you. Thank you very much, Melissa. Another question from Louise. Thanks for a great presentation. I'm wondering how readily you were able to access Commonwealth data, e.g. Medicare PBS Centrelink, which is sort of answered, yeah.
Yeah, I actually haven't been able to get my hands on MBS and PBS data, although I'm involved in the POCL study and they are attempting to get access to that data. So I think there's still a number of hurdles in regards to the state versus national legislation requirements. But I believe in the next 5 to 10 years that issue will be resolved, and I'm hoping it will be, because I think there has been too many delays. And I know they're making more of the health data, national health data, more available. And I think that's a really good move for researchers to be able to access that. And it's so essential. And I think government are realising that often government don't have the capacity to do the kind of level of data analysis and interrogation of data that researchers do. So I'm hoping that by them saying that the capacity, particularly when there's been a lot of government cutbacks and researchers are being let out of departments, they realise the importance of researchers to be able to support the work that needs to be done in terms of evidence.
Thank you. Another question. What are your reflections for child workers in India?
Oh, that's a good question. Yeah, it's been really interesting on the International Trauma Treatment Data Working Group. I think there's a lot of challenges in across countries about how we collect data and utilise that, and how we can support those on the ground to be able to work more effectively. And I think that's the key, is that interagency collaboration is really essential. For nurses and child protection workers on the ground in different countries to be able to work across those social support agencies and linking families in with agencies where it's possible to do so, and with the supports that are required is essential.
Thank you. Okay, I think it's probably time to wrap up. And on behalf of the PHRN, I'd really like to thank you, Melissa, for your very interesting presentation today, and thank you to everybody who has attended our Webinar Wednesday. We do have a few more webinars in the pipeline, and they will be advertised on Twitter, or you can join our newsletter subscription through our website, and you will be notified of those presentations. So have a great day, and thank you very much for listening.